All right. Now, I have the pleasure of introducing our next president, 24-25, is Dr. Ann Rogers. Ann has done a lot at FASMBS. She's been very involved on many committees. Particularly, she's worked on the Clinical Issues Committee and has had a real hand in kind of shaping our not just our literature, but our guidelines and other publications. She's always had a very critical eye when we review all of these. For the past 7 years that I've been on the EC, she's always been incredibly helpful in reviewing these different articles and really has been so thorough. And it's been a real pleasure working with her on the Executive Council, and also we have a work group of the four of us, the past president, current president, president-elect, and the secretary-treasurer, and she always has a lot of insight. And I've always liked to think that I was the funniest person in that group, but in truth, Ann is actually quite humorous. Her dry sarcasm, you guys are going to be loving that for the next year. It is really my pleasure to invite Ann up here. Thank you. Your future president, Dr. Ann Rogers. They're kind of bringing her up here like a lamb for slaughter, but it's not going to be that bad. This is your gavel.
Thank you.
We have to stand for a picture.
All right.
Okay.
We'll do it at the end. Okay. All right. Well, I think that I prove that if you live long enough and get old and crotchety, you too can become somebody important. So thank you, Marina, and that was a really great talk, Paulina. That was amazing. I want to thank the three friends who just perp walked me up. Every past president has been incredibly helpful for me, and I just appreciate so much the advice. These are particularly special guys. The first is Shanal Katari, who's been my friend for a very long time, and Jaime Ponce has also been a great friend, and I think he's the first person who nominated me to be on the EC, and I will never forget him for that in a bad way. And Eric DiMaria, who has been there through thick and thin, and they've all been really, really very positive influences on me. I just wanted to say thank you to all of my past presidents and future presidents. They've become amazing friends and have meant the world to me. And I want to thank Marina Kurian in particular for having a great meeting and a great year, and we've really had a lot of fun together. This is your current executive committee. This is the, I don't know, they call us the presidents. Marina is currently the president. I'm the president-elect. Rich Peterson will be following me as the vice president. Teresa LeMasters is obviously our immediate past president. We have a senior past president, Shanal, and he can't wait to get off of these pictures. And we have a new chief executive officer who is Dr. Diane Enos, and she's done a world of good for our society and will continue to do so. So we're going to have a slight change. I guess I get to become president. Rich is going to be president-elect. Our new vice president is Dr. Joan Northup, and he's fantastic. And Marina will now step up to become immediate past president, and Diane, thank God, will stay on telling us what to do. We really need that help. Now, I want to put a plug in for our current board of directors. This is what we previously referred to as the Executive Council. We've changed the name in the bylaws, and you all approved it, whether you know it or not, to call it the Board of Directors. And this is the governing body of this organization. You folks vote them in, and they are really making all of the day-to-day decisions of how this organization works. They serve 3-year terms, and we have some people who are finishing their terms. Those include Farah Hussein, who's been an amazingly thoughtful part of the EC, and Dr. Corrigan McBride, who also will be rotating off. And of course, Joe Northup rotates off because he's becoming an officer of the organization. So this is the upcoming board of directors. They start serving as of later today. I pity the fool. But that includes Dr. Ben Clapp, Dr. Matt Crow, and Dr. Pearl Ma, and I expect really great things from them as they help us. But really, please take the opportunity to vote. It's very important because these are the people that are going to be directing how the society goes forward. So that's all I got. I just want to now invite up to the stage some people who are going to make some remarks about Dr. Marina Kurian. They're good friends of hers. They're Dr. Emma Patterson and Dr. Christine Wren Fielding, and they have some really amazing things to say about Marina. So get ready.
Thank you very much, Ann. I'm Emma Patterson.
Christine Wren.
And we're very honored to introduce our best friend, Marina Kurian, as president. We met Marina in July of '99 when the three of us were fellows at Mount Sinai. We had a blast. We worked hard. We played hard. And we've all gone on to have busy and successful careers, and we couldn't be more proud of Marina now at the pinnacle.
And when we met her, she was friendly, smiley, and touchy. And so we thought, oh, shucks. Oh, it didn't go. Hold on. There's another thing that goes on there. She was smiley, friendly, touchy. Was she a lesbian?
That turned out to be me. We became quite famous as the Endo Angels, and we've sang at many conferences, each other's weddings. These are some of our greatest hits.
Right. Our first one was, "It's been a hard day's night, and I've been working with the scope." And then it was, "I'm a bitch, I'm a lover, I'm a surgeon, I'm a mother." Remember that one in the 90s? And of course, Mambo number 5. "A little bit of Ethicon in my life, a little bit of Stryker by my side."
All right, so we thought it'd be appropriate today, in Marina's honor, we're going to sing a song. Please join in. Volume up, please. There we go.
Where it began, we do begin to know when, but then we know she's growing strong. Was fellowship, fellow became attending. Who'd have believed you'd come along? Days into weeks, into months, into years, now president. Sweet Marina, ba ba ba. Good times never seem so good, so good, so good, so good. We've been inclined to believe you never would. Oh, now we look at the year, but it don't seem so easy. All the work that you have done. And with the kids, Lord knows they made it better, getting you through those stressful times. Meetings, more meetings, committee meetings, conference calls every night. Sweet Marina, bum, bum, bum. Good times
It's never seemed so good, so good, so good, so good. We've been inclined, bum, 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 to believe you always would.
Sweet Marina. And now, thank you, Madam President. We introduce you to come and give us your annual.
Someone else. Oh, Teresa's
Teresa.
next.
Okay, sorry.
No,
Teresa, come on up.
Teresa's going to do the formal
Thank you, Madam
introduction. Thank you.
Thank you. That was amazing and a lot of fun. Great to see the transformation and evolution of Marina from a young surgeon into the giant that she is today. Good morning to all of you. I'm so happy to see you here today at our 40th annual meeting. I'm Dr. Teresa LeMasters, and I'm the immediate past president. And yes, I do get the job of getting to introduce our current president, Dr. Marina Kurian. Just a little bit about her origins and her academic background. She was born in Bonn, West Germany, and she completed a 6-year combined undergraduate and medical school program. She got a BS in biology and modern language from Union College in New York, and in 1990 she completed her medical degree at Albany Medical College. She continued on there for her surgical residency, where she served as a chief resident. She also completed a surgical critical care fellowship at the Children's Hospital of Michigan at Wayne State University in Michigan. She then did her fellowship in laparoscopic surgery at Mount Sinai Hospital in New York, New York, and she never left. So she's actually spent the past 20 years in practice in New York, which is really pretty formidable. She's experienced lots of different practice environments. She was gone between employed practice to academic practice to private practice. And she's currently in private practice with New York Minimally Invasive Surgery, operating at Lenox Hill Hospital and NYU Langone, where she teaches residents. She offers all bariatric procedures, including revisions in her practice. Marina is a published author. She's contributed to the literature with over 50 peer-reviewed articles. She's written dozens of book chapters, and she's also contributed to the bariatric surgery topics in Up to Date, which is widely used by the primary care community in the US as their first go-to source for their day-to-day clinical practice. She also has authored some other types of books. She was the co-author for Weight Loss Surgery for Dummies, which is actually a comprehensive, compassionate, and very well-reviewed guide to weight loss surgery. Now, most of you who know Marina know that she's really a very globally focused president. She oftentimes says that her mentor, Michel Gagne, told her from the very beginning, "You're global." And I think she really leaned into that and expressed her energy and enthusiasm there. She's really presented around the US and around the world. I oftentimes actually get asked this question: where is Marina? And I can actually tell you it could be anywhere in the world. Literally just this year alone, she presented at all different corners of the world, from India to Austria to France to Brazil, even down to Argentina. Really, truly a global reach. She's also a mentor to many. She's mentored many medical students, residents, and faculty at NYU. And I can tell you that many of you sitting in the audience would say that she has been a mentor for you in your career as well. She was a founder of the Women's Leadership in Surgery Society. And she also is a very generous, warm person who loves to give to others. Now, she describes herself as a nurturer. I have to tell you, I did not think that was a real word. So I went and looked it up in the dictionary, and guess what? It is a word. So the definition is someone who nurtures others, offering food and support. So this is one of the many examples of Marina as a nurturer. She invited the entire executive council, which is now the board of directors, to her home, her personal home in New York, where she served us a home-cooked meal that was amazing, and she had the help of her amazing mother, who is a fantastic cook. So again, very generous, warm, and nurturing. So for some of you, you may not realize that we have a movie star in our midst. She is nationally recognized as a leader in bariatric surgery, and therefore she's frequently featured in media specials and lectures around the country. She's appeared in the media on the Today Show, the CBS Evening News, Dateline, ABC News, CBS News, Fox News, Discovery Health, and she even hosts a weekly radio show on Sirius XM. She has many, many contributions, and she's served across many committees in the FASMBS. She's also served as co-chair of the Communication Committee, chair of the Insurance Committee, and chair of the Private Practice Community Practice Committee. She also served as the president of the FASMBS Foundation, which is now the TRIO Foundation, and she has served on the Executive Council since 2017. But now I have a few fun facts you may not know about Marina. It's okay, don't be scared. What does Marina love? Well, first, I'll tell you that Marina loves being fashionable. Now, she may not be quite on the Gerhard range, but she's pretty darn good. And I can tell you that she's gonna look fantastic tonight at this event, as she does at all events. Truly amazing. Marina loves travel. Now, this isn't just for work. She does this for fun, too. But she really loves to travel with friends and really expands her reach to every corner of the globe. Marina loves adventure. Now, this is a picture of her at the Kentucky Derby. This is an interesting look, but it looks beautiful. But this is also her fishing in Montana. And she's not afraid to go in there and get her hands dirty. So Marina loves her pets. And I'm going to tell this is her cat, Flava, and her dog, Sunny, as well as her late dog, Friday, who's no longer with us. But if you've ever been on Zoom calls, which I've been on very, very, very many with Marina, you may get the chance to meet her wonderful furry family as well. Marina loves friends. And many, many of you, again, in this room can attest to this. She is warm, generous, and she really is able to give and surround herself with wonderful friends over many years. But most of all, Marina loves family. And her family is here today to help her celebrate this wonderful event with her kids, Kieran and Kavi, and then also her dear mother, who supports her every day. So I want to tell you that it's been my pleasure working with Marina for many years, actually, and getting to know her better. She is a true shining star for our field, and it's my honor to introduce our 37th president of the FASMBS, Dr. Marina Kurian.
I'll fall off the stage. Thank you so much.
Great. Go get him, Tiger.
Yeah. All right. Thank you. That was fantastic. I love the singing. I'm so touched that you guys sat together and wrote a song for me. And now you know why our greatest hits album is not out, but still. You know, it's a tough thing to figure out what it is that is going to hit the mark for you guys, right? But part of the reason that I wanted to become president is I wanted to make sure all of our members were represented well. And because I had gone through community practice and then academia and then private practice, you know, I thought I have a perspective for all of those, and I wanted to be sure all of you are there and represented within FASMBS. Now, originally I was going to do a SWOT analysis, but I didn't like the T. The T in a SWOT, it's strengths, weaknesses, opportunities, and threat. And I don't think we're threatened. I think that there are challenges. And so I settled on a score analysis of FASMBS. And doing this, I'm going to come through and give you a lot of the information of what we've done through this past year. Now, you heard already that I love my kids and my mother and my father. My kids are the ones that make sure to let me know when I'm not as cool as I think. And, but sometimes I catch them and they're like, okay, you're pretty cool. So that's also nice. And then sometimes when I'm thinking like, oh, this isn't working out, my mother is like my best support. And Teresa pointed out that I had a meal at home. Guys, my mother is, okay, I'm gonna tell you a secret. She's 88. She always gets mad when I tell people her age, but she's not here. But I made my mother cook for everybody. I'm not that good a person. Not only that, okay, this is my team at work. I have to give a shout out. There's no way I could be, and plus the amount of travel I do, my staff are getting so creative and, well, she's at a meeting and they're like, how many meetings can she go to? But they've dealt with all of my travel so well. But I also, my mom's my nurse. I made her get her license. Like she was like, I'm retiring. I'm like, no, keep your license because she comes into my office and sees patients with me, and my patients absolutely love that. And it's elder abuse because I don't pay her. I don't pay her. Okay. I'm going backwards, sorry. Green button, got it. So SCORE, what is it? Strengths, challenges, options, responses, effectiveness. So our strengths, our greatest strength actually is the team behind FASMBS. You know, we have our new CEO. You guys approved the bylaws changes. But so that's Diane Enos, and I hope many of you have met her already. And you all know Christy, Jenny, and Kim Carmichael is a little bit more behind the scenes. James is responsible in helping out with the new website, which is really going well. And I can't name everybody because I only have 35 minutes, so I have to get through. But those guys, I've individually worked with all of them, and they are just wonderful. And they put on a great meeting, no? This is like, we're not suffering from AV issues. Our other strength is really all of you, our membership, because you're engaged, because you're letting us know what it is that you need, we're able to really move, and this is done through 24 committees, 5 task force, although we're winding down a couple of them, and 1 work group. This makes us very agile. We have the ability to pivot and pursue on different topics, and I'm going to go through a few of the things that we did this year, and you'll see how that really does make a difference. So one of them is we've had this organizational collaboration. This one is on GLP-1s. Remember when the ASA just came out and said, hey, you guys all have to stop GLPs for a week before, right? And then some of our hospital systems are saying, actually, no, you have to do it for 2 weeks. Well, there's no real data. So we put together a group and worked with also the ASA, and this collaboration, Teresa actually ran that. And then Tammy Kindle, you're gonna hear her name a lot. You're gonna hear some names because these are people who are very active, but they worked on it, and that should get published soon. Other things that we're involved with and other collaborations that are very important to moving the needle on obesity care, and this just shows you some of the things that we do. So what are our challenges? You might say that this slide, where we're actually doing 20,000 more cases, is great. But in fact, we all know that we're addressing 1.4% based on the old guidelines, and probably about 0.7% of the patients that we could be helping, right? So new guidelines are out, and whoop, let me see what's that. What we need to do is try and grow it. And we've been talking to industry, and we've been talking to our referral and other providers to try and change that, but it's not really been substantive until now. We're really at a pivot point, or a tipping point, if you will. So there's a lot of discussion now on the obesity and obesity care and treatment. There's in social media, you can't open it without seeing an ad out there for some new weight loss method. And then it's also coming, and the messaging is going not just to the adults, but to kids. So we are seeing a lot more discussion on obesity, which is important. And so if this discussion, we can, through this discussion, get hopefully some more physician referrals, and also our other challenges, though, are trying to keep our outcomes. I mean, if as Dr. Salonen just pointed out, the follow-up is even tough in Finland, which is a small country where they can actually track people down. Just look in the woods, right, Paulina? They'll be there. But so it's hard, but we do need these outcomes because one concept that I've had is that metabolic and bariatric surgery really needs a facelift. We focus on our, we're trying to minimize our complications. We're constantly working on that. And yet, what do patients tell you? I don't want the bypass because I had an aunt who died 20 years ago, right, from it. Or I know someone who had a leak. But meanwhile, we know those complications are actually very, very low. So we need a better way, and that might be the future of trying to figure out how to get a better sense out there. And I'm going to talk about a module that we're going to do. And follow-up and aftercare is also still one of our challenges. Complications, like I said, we need to kind of work around and try and get people to understand that these are very low occurring. Did you guys, and I know you all know that because you tell your referrals and your patients that, bariatric surgery is safer than a lap chole, right? So we need to get that message out. One of the things that I did with Emma's help, actually, Emma Patterson, is create a Wernicke's task force. I'm going to talk some later about what they're doing. So the medications have been a challenge. The costs of medications, and then insurance is looking at what we do and how much it's costing them for surgery versus putting patients on meds is an ongoing discussion, and we're going to talk a little bit about that too, because we've seen some changes in insurance coverage. And of course, all of these things, the prior auth is a terrible situation and bureaucratic headache. But what are our options? So I said medications were a challenge, but medications are also an option for us, not just for treating weight recurrence, but for using this opportunity to just switch that dialogue from you need to take a medication forever and it's very expensive to now all of a sudden surgery's looking a lot better. This was
Obesity
great.
is a complex disease.
They are the new drugs sparking the weight loss revolution.
All of a sudden, I felt like I was freed.
But there's confusion and controversy. Are the medications safe? Should children take them?
She would be 500 pounds by 16.
So I'm having a conversation with lead experts to answer our questions.
These medications are really a game changer.
Let's stop the shaming and blaming. An Oprah special, Shame, Blame, and the Weight Loss Revolution.
So that was great. I didn't make popcorn, but I made sure to clear my schedule, and I was not on a call when this was on, mainly because I wanted to see what she said. She has always been such a diet, exercise, this is willpower, and she's always been that person. So when she started this and had 2 specials, actually, it was really making quite a difference. And I think the fact that we're showcasing obesity as a disease is so important to how our landscape's going to change. So one of the things that I wanted to do under our options is I've asked Rakisha Wilson and the Public Education Committee to help with that metabolic and bariatric surgery facelift. We're going to create a module on how things are improving, and it's also part of my butterfly effect. That's why I picked that as the theme, because I'm wanting to show and really, I don't want to say shove it in the face of all the people who are touting medications, but just to show that we do improve every health outcome with greater percentage change than just medications. And then what we do with this module is you can share these FACS to all your referring physicians and other providers. So who knew that in 4th century BC we'd have, we're all experiencing a similar thing. The enemy of my enemy is my friend. This actually came from 4th century BC. But what I put that up there is because I'm not saying insurance is our enemy. I'm not saying pharma is our enemy. But what's interesting is because of the cost of the medications and the AOMs, our coverage is completely changing. And our requirements are changing for surgery. And if you go on the website, you will find under, I think it's under Access to Care Toolkit, you'll see how many of the plans have actually changed their guidelines and requirements, including making it quicker to get to surgery, taking away barriers. And some of that, and a lot of that work actually has been done by Joe Northrup, who is already, because I passed the gavel, your future president and vice president of ASMBS. The other thing we're doing is allowing our members and our bariatric surgeons to have a special distinction for doing what we do. And this FPD that Jaime Ponce and Eric DiMaria before him all worked on is our opportunity to really showcase that we are experts and that this is something that is a specialty that is worthy of having that designation from the board. And currently we have 247 total diplomats. And then when this was done, though, there were two groups that were excluded. One was military committee, and they have been working, board certification committee has been working to try and work with our military committee to change that. So that's in the works right now, and so there is a pathway going forward. And then also our DO surgical colleagues were excluded from this, but through a lot of negotiation, and Adam Smith and Carl Pesta worked on this along with Jaime and with Joe Beiske at the board, and now they're going to be able to take that in the 24-25 category so that they will be able to get the FPD as well. What have been some of our responses, right? So Rachel, by the way, can we just give a shout out to the programming again? Rachel Moore did a great job along with the program committee and Rana. Thank you. But anyway, Rachel likes to say that my biggest crisis this year was actually early on, the CMS trying to take sleeve and bypass off the inpatient only. And it affects a lot of us, and it would have affected, certain programs, but it really would have affected the patients, because many of the patients who are Medicare patients are the ones that have a lot of comorbidities and they're not candidates. Well, so to speak to the agility of our ASMBS, we were able to put together a group of people to work on this. Renee Hilton and Tammy Kindle wrote a response because each society that was involved, and we worked with ACS, we were on calls with them and with SAGES, and Renee and Tammy wrote the response for us. In addition, we were able to outreach to you guys, and I want to thank you. I think it was close to 600 people that responded, but over 500 put a response to this. It was a call to action for all of you, and I want to thank you all for doing that so that we could preserve that. And then we got this letter saying that they were not going to take it off, and that was important. So the 2022 guidelines made a difference, and I'm going to show you in a little bit how much of a difference, how many patient lives are covered. And currently, it's published light. The scientific evidence is here. It was taken down because it's supposed to be a simultaneous publication with obesity surgery. But we have now the levels of evidence for all of our updated guidelines, and that's going to be published this year. But to speak to that module that I wanted to tell you guys about, it's about the FACS that you can have at your fingertips. And this module should hopefully be done in the fall, where, for example, patients who have metabolic and bariatric surgery had a 32% lower risk of developing cancer, 48% lower risk of cancer-related death. Those are important things that we can tell our referring physicians and also ultimately relay to our patients, because I think moving forward, those mods, certainly that our patient-facing website is going to be important in showcasing all of these important benefits of weight loss surgery. This trial, again, Ali Aminian is a great researcher, and this shows a 35% reduction in the Splendid trial, and this is also stuff that we need to know, that there was a reduction in obesity-associated cancers, right? Amount of weight loss matters, right? The more weight loss, if it's over 20%, and most of the medications now, some of the newer ones are going to get up to 22, 24%, but more than 20% total body weight loss resulted in greater than 50% reduction in cancer risk. So the total amount matters, and bariatric surgery is going to get you, many times up to 40% total body weight loss. And lastly, I wanted to say, this is part of my whole facelift for metabolic and bariatric surgery. We're also seeing a lower incidence of breast cancer, but also lower tumor grade. So less severe disease in patients who had bariatric surgery. You guys all know I'm from New York, and I was working on 9/11, but these signs started popping up after, right? And you really can't get anywhere in New York. It's a little bit less now, but you'd always see this sign. I put this up here because this is what all of you do. If you see something, you let us know that there's a problem, and again, we can get to those 22 committees or 24 committees and have them address it. Some of the things that our committees have been doing in response, so our insurance committee under Mike Cook is doing a statement on paraesophageal hernias that will be going into publication, and it's talking about billing, appropriate billing and reimbursement, and I think that's of a great value to you guys and to me, because I do a lot of foregut too, and paras. And they're working on a position statement for insurances to accept bypass for other indications other than severe obesity. And I know many of us do this, and we will use different coding and things like that, but sometimes there's a big fight to try and get it approved, and I think having more literature out there will definitely help us. This is, you may have seen it, so QIPS is doing, or Quality Improvement and Patient Safety is doing a same-day surgery survey. I know my biggest crisis was having sleeve and bypass stay on the IPO list, but again, there may be select candidates that would actually do very well with outpatient procedure, and I know many of us did this during COVID, but many of you are already doing, selected patients, and it would be nice with the survey to figure out who those patients are. And I know this because I know it personally, that insurances will actually, so they will pay you a little bit more depending on your contract if you do it outpatient versus doing it inpatient at a hospital. So this is something that we want to flesh out and see how we can actually make sure that all of you have that knowledge to kind of create those contracts or carve-outs. And so that insurance company will also be working on that once we get a little bit more. Wernicke's task force has been doing a lot. Emma is tireless and fierce and gets us to do all of these calls and review all these papers. Why Wernicke's? It's preventable. It's completely preventable. We should not be seeing any cases in our patients. I've been on the task force and reviewed the articles and learned so much doing it, and I thank you, Emma, because you really pushed and said this was going to be a great thing, and it totally is. And everybody on that task force, one, is amazed because we're all learning something. Two, they were like, of course, Marina, you would make a task force and label a WTF. True, none of us even knew until it popped up on our calendar, and that's what it was. I'm like, what? What do you mean what? Anyway, but there's going to be, we're just getting close to finishing, there's going to be a literature review and a practice guidance. I'm all about the modules. I'm going to create a module where Emma's already working on it to give to you guys. It's going to be FASMBS branded and CME, something that you can share with every department at your institution, share with your residents and other, even medical students, I think, and it would be great. We're also going to work on a ER poster update, and Quality Improvement Patient Safety, QIPS, is going to do a closed claims analysis, and WTF is going to pull out the Wernicke's cases and do that. So you guys look forward to that. We should be able to get that done within the next year or two. This is kind of, I want to show you some images. These are not final, but we know the classic triad, and you know what? The classic triad you only see in 10%. So you have patients that have Wernicke's, but you're not seeing the full triad, so you can miss it. So the newer thing is the Kane criteria for Wernicke's, and it only requires 2 of them. So dietary insufficiency, eye signs, cerebellar signs, or mild memory impairment. But using that, if you have 2 of those, you have a 94% sensitivity and specificity for the having Wernicke's encephalopathy. And this is the one that I like the most because yes, there's primary prevention in your diet. Thiamine, 100 milligrams, that's what we all give. I tell my patients to take it the month beforehand. I think it was Muhammad Ali in one of our committee meetings said that he did an analysis and had 27% of patients pre-op with thiamine deficiency. And I don't check thiamine pre-op. So this is a thing, and prevention for us in our ERs, and Christine made sure that at NYU, the ER knows that when the patient comes in, they have to get a banana bag. Guess how often that happens? I mean, like it doesn't happen 100%, but it should. And so this is another reason the module's going to help. And lastly, the thing that I was most happy about learning was that high-dose IV thiamine, you can give up to 500 milligrams IV Q8. There's no overdosage, right? So this is an important thing that I think everybody needs to know. And if you give patients high dose, you can actually, in many cases, there are a couple articles to show that you can reverse that encephalopathy. Bariatric Surgery Training Committee won Committee of the Year. They would just give a clap for them, please. I went to the fellows reception last night, and they really are our future. And I think what I love is the degree of engagement. Adrian Dan, Kanur, and now also Shana Eckhouse are running this committee, but you can see here the people who are involved. There's a happy hour, there's a credentialing process as well. And we also did the START program a couple of years ago, but now we're having, it's ongoing with Matt Martin, Adrian, and it's making a difference. We're going to get the fellows involved with robotic training. I am the self-proclaimed liaison to the Advanced Practice Provider Committee. I don't know that they ever really wanted me, but they got me, and I always have been working with them. Last year, they did the assessment-based certificate, the ABCs of bariatric surgery for APPs, and it was well attended. I had been wanting them to do a course on medications because, as you all know, I medicate a lot of my patients, and they just did it. And it was a successful course and then exam. They had 111 course participants, and this is so that as a member benefit for our surgeons and our patients, that our APPs can actually come back and with a fair amount of comfort and certainty to prescribe in our patient population. So can I just get a clap also for the APPs? They worked so hard. They worked so hard. Karen Flanders, Deb, Alice, and I know I'm blanking on the next person, but forgive me, whoever it is, because I still got slides to get through. Okay, so International Development Committee, Rana Polat and Rami Lutfi are the chair and co-chair, and many international surgeons had approached, when Shunnell was president, to say, hey, we'd love to have a certificate from FASMBS showing that we have the metabolic and bariatric surgery knowledge. So Rana really worked hard and got members of the committee to put together an exam, and we have successfully launched it here, but it's going to be continuing to roll out, and it's an international accreditation certificate, and we have this is something that will go forward. And it means a lot because we have the expertise and the gravitas at FASMBS, and this is something that international members would like. So how about our effectiveness, to get back to this? So Diversity and Inclusion Committee, all of our committees do a lot of things. It's just, I only have 35 minutes to go through all this. So one of the things that I wanted to touch base on, Pearl Ma this was her idea to do a surgical mentorship program. It started in 2022. The 23 cycle, there were 16 or 10 pairings. But it's important to get that sort of 360 back from them. And so they did this, and you see that 85% of the mentors would do it again, and of the mentees, they said it met expectations, 75%, but 100% agreed that the mentor engagement was there. you guys should be looking for, it's going to be published hopefully soon, the intraoperative pathway and the postoperative clinical pathways for gastric bypass. We already had the pre-op a while back, but the QIPS team really got all of this done for you guys, and it should be out this year. And again, I want to talk about the cost of follow-up and the cost of medications and what it's going to mean for us, right? So Joe Northup just told me that, first of all, the big story here was in California that the California patients would need to do 12 months of medication before getting surgery. Well, now that there's Ozempic and the costs, and Wegovy and excuse me, the obesity treatment, so Wegovy and Zepbound, now they've changed it to many plans have tried to change it to make it so that surgery is more accessible. And we just heard that Blue Shield took it a little further and are asking patients to be on a 6-month diet just so they can get the GLP-1s. So it's like the tables have turned, and it's easier to do surgery now rather than getting the meds. So this is how access to surgery is improving. There we go. Okay, also, access to care has really been working hard. So based on the new guidelines, we have 120 million lives covered. And then also on the other side, it's almost 49 million patients have access to SADS. And that's also through efforts with insurances to try and get this all approved. And so that means that, probably many of them are giving you the codes, like Cigna would tell you which code it is that you're going to use, but this is just showing you how effective our ASMBS committees are. Clinical issues committees had a few publications this year, and you can see them here. There's a lit review on internal hernias, and then we did one on ESG, OAGB, as well as a position statement for patients under CMS and evaluating the benefit of surgery. Program committee did a great job. I've already been saying this to our executive council, but the New Orleans meetings was the best weekend meeting ever. We had the highest attendees, and now this meeting here, thanks to all of you, is also, we have over 2,600. Those were yesterday's numbers. We have over 2,600 attendees, so I want to thank all of you. Let me clap. Thank you. And so far it's been a fantastic meeting. I hope that you all agree as well. So can I ask, though, I am winding down, can I ask all of our committee members to stand, please? Come on, just step. You guys can do it. Let me see you. Right? Are you up? And you guys look around who are seated. These are your committee. These are the people who fight every day. There's more of them. Are they getting coffee? I don't know, but there are more of them. But this is a volunteer army. I want to just congratulate all of you guys. Thank you so much. I mean, it just shows you how we're doing it, how we get everything done. I mean, there's no other society that has monthly meetings or weekly meetings. Access to care, actually, Renee can be on 3 out of 4 weeks in a meeting. But what's the future? Many of our past presidents are here, and they've talked about, and I heard at the Festschrift as well for Dr. Pori's, about creating metabolic disease centers. And that way, your endocrine specialist and your internal medicine doc, your obesity medicine specialist, and your surgeons are all in the same spot. Maybe that's the future. It works if you're in a health system. It doesn't work so much if you're in a private practice system, but I do know that, one, if we were all in that group, it would do better for follow-up, because then we wouldn't lose patients, because patients would still see their internal medicine doc and still get referred back. Or if we were in that group, then everybody would know how to treat weight recurrence. So this may be something that's in the future, but I know that if it is in our future, this organization, ASMBS, is the one who's going to define it and perfect it and make sure that everyone who who is involved is well-trained enough to keep that going. My daughter can officially say that she is my favorite because there's one more picture of her. My son says no. I'm a New Yorker. I'm a Yankees fan. That is yeah, I know. Let's go, right? But that's my. And that is Aaron Judge. And I don't know if you don't follow baseball, then, as Rachel would like to say, that I'm being sportsy. But he is a phenomenal player, had an amazing rookie year. His first year, they created the judges' chambers. If you go to Yankee Stadium, there's a section that's considered the judges' chambers. And every time he hits a home run, there's a thing that we do, which is, I'm going to show you here, all rise. If I could have all of you stand up, please. Come on, guys. Thank you. I think when you all stand, you see how we, I'm sorry, I'm not tearing up. We didn't even take bets on if I was going to cry or not. I did not, but if we all stand together, right, there's no distinctions between a committee member or anything. This is why we're here. FASMBS is such a great meeting. It's an opportunity to talk to each other. It's an opportunity to learn from each other, whether you're on a committee or not. Sitting next to someone, you chat with them. It's so important. And I know that with all of you guys, we're going to continue to make that difference and elevate metabolic and bariatric surgery. And I wanted you all to stand because I wanted to tell you that I have been so honored to be your president, probably the greatest honor of my life so far, and I am very, very thankful for this privilege. So thank you, guys. I don't know. Oh, Teresa, there you go. I was like, what do I do now? I have another meeting. That's what's happening.
That's okay, I got you.
Okay.
So it is my pleasure and honor to give you this recognition today from the FASMBS. I'm going to read it here. It says, "Be it known, the Society hereby recognizes and honors Marina Kurian, the 37th President of the FASMBS."
Okay. It's a mirror.